Hello, everyone. I am here today from Oasis Dental Arts, Dr. Raman Goshtosky's dental office in Scripps Ranch, Mira Mesa, San Diego, California. And Dr. Goshtosky, Dr. G as we call him, wants you to know things about dentures. These are very important things for you to know about dentures if you have them or consider getting them. So, facts that you need to know about dentures. The first fact is that dentures are the easiest and most cost-effective way of you replacing your teeth. Okay, very important fact. Next fact you should know is that dentures will never be a replacement of your teeth, unfortunately. However, you will get back about 30 to 40% of your function. Next fact to know is you do get loss of some flavor because the denture does cover your palate where there are taste receptors. And these flavors that you may lose are sweet, sour, salty, and bitter taste receptors. Okay. On the right side, though, you get your smile back and will look younger because your face will not collapse in when you have your dentures in your mouth. So you're likely to get younger. Next fact is that dentures can sometimes be associated with pain and discomfort because they're floating around inside your mouth, rubbing on the tissue, okay? So this possible pain and discomfort can generally be relieved by adjusting your denture. And sometimes it takes up to 3 visits for you to come in and have your denture adjusted to feel better about it and not have the pain and the discomfort, but it is definitely possible. Next fact to know about your dentures is that as a person gets older, as we age, then it is possible that you experience bone loss. You will experience bone loss in areas where you have missing teeth. So dentures are not going to fit as tightly at that point, correct? So each set of new dentures will not provide as good a fit as the one before it. And that's because of the bone loss we experience as we age. So patients who wear dentures long-term then, in addition to the bone loss, will have scar tissue that forms under the dentures. Most often that results in the denture not fitting as well. These are the realities, okay? And the next fact to know is that dentures, just like your teeth, need regular and routine care and maintenance to keep them clean and functional, okay? The average life of your denture, if you maintain it well, is 10 to 15 years. And we've seen them last much longer. So you take good care of your dentures, they'll last you a long time. As the bone is lost, the inside of your denture may need to be redone for a better fit. Okay, talk about maintenance, right? And that generally means you come in every several years and we redo the inside of your denture. Dr. G does the inside of your denture. Whoever your doctor, dentist is, will do the inside of your denture. Okay, so that's how we maintain the denture for longevity. Now, you may be asking by now, what are the alternatives when you have lost or missing teeth? Okay. Well, you have 3 as we see them, as Dr. G sees them. First, you can leave the space empty. You don't have to put anything in the space if you don't want to. Of course, you're probably, after speaking with Dr. G, you'll know that you're probably going to lack some functionality, ability to chew properly, but you could leave the space empty. Option number 2 is you can get full dentures, uppers and lowers if you need them. And then option number 3 is you get full dentures that lock into implants to hold them stable. And if you're wondering what that entails, you can come in and Dr. G or your dentist should be able to explain that to you. So those are your 3 alternatives. Now you should be thinking, who is a candidate? Am I a candidate for dentures? Well, anyone who's missing teeth or a tooth is a candidate for dentures. But, and here's your but, not everyone can get implant-supported dentures. Remember the ones where the implants support the dentures? So you may want to consider full dentures, not implant-supported dentures, if 1, you're a grinder, you grind your teeth, okay? As your dentist told you, you're a grinder. 2, if you're diabetic, okay? 3, if you're a heavy smoker. And 4, if you have a compromised immune system, all right? And of course, number 5 reason is if costs are something that prohibits you from getting implants that would support your dentures, okay? So if you have conditions 1 through 4 in this list, it likely means that you are not going to be able to qualify for implant-supported dentures, but you may want to consider regular full dentures. Now, let's talk a little bit about the cost of dentures. First of all, insurance generally dictates the price, okay? There's a wide range of fees that insurance companies charge, okay? And that's all up to the insurance company. It has nothing to do with the dentist. Your dental office, though, however, should go over your coverage and fees with you. We certainly do in our office with Dr. G's team. Number 2, pertaining to cost. If you don't have insurance, that's okay. You should just know that the average cost of an arch, and an arch is either an upper arch or a lower arch, of non-implant supported dentures, okay, costs $1,500 up to $2,500. And there are many factors such as the type of teeth used, so the construction, the material used, the technology used to create the dentures, and the material costs that are ultimately going to determine what you're charged between this likely range of $1,500 to $2,500. Okay, but that's just an idea to have if you don't have insurance. And number 3, in our office, we use the newest 3D technology that's going to create a superior fit, strength, and durability to your dentures, okay? So that may be a cost consideration as well. So how long does it take to create a new set of dentures? Well, there's a huge variation in the time it takes to make dentures. And the range can be from 2 weeks to 2 months, and it depends on where you go, who's your dentist. So a couple of things that determine how long it takes. Number 1, do you need dental extractions? Okay. If you need extractions, that could add to the length of time it takes to make your dentures. Number 2, the type of denture that's being made. What kind of denture are you getting? That will lend itself to how long it takes to get them done. Number 3, do you have existing dentures? If you do and you bring it in, for instance, to our office with our technology, that will make it a faster process for us to create your denture. And number 4, what's the technology being used? Like I said at the very beginning, for instance, at our office, we have the most current technology to shorten the number of appointments, okay? And as an example, if you have an existing full set of dentures, like I said earlier, it just needs to be rejuvenated. That new set can be made in as quickly as 2 appointments, okay? But there is a spread based on the technology and all these other factors and where your dental office is in the spectrum. So in conclusion, dentures can help you get your smile back and make you look younger, of course. And like anything else in life, there's some compromises that you need to be aware of. And hopefully we've made you aware of them. However, overall dentures are a great alternative to not having any teeth and not having the functionality of being able to chew. And so now if you have any questions, or maybe you're ready to get your dentures, call us 858-271-1010. 858-271-1010 to schedule a free consult and to discuss your options with us. And we hope this has been helpful. And until next time, we will see you later.